Welcome back to New Day Northwest. For those dealing with alcohol and drug addictions, the reality of finding safe, effective, and affordable treatment, it can be really grim. Lakeside-Milam Recovery Centers have been treating addiction issues in our community for more than 40 years. CEO Carl Kester joins me now. Thank you for being here. Will you share exactly what Lakeside-Milam offers?
Certainly, and thank you for the opportunity to be here. Probably the most important first piece is the assessment, helping an individual or family see if the disease is there and what the problem is. And then we've got outpatient treatment, inpatient treatment, mental health treatment, and education programs as well.
That's amazing. And for the families, too, of these?
Yes.
Because that was key. I was just sharing that, you know, my own family has struggled with addiction, and it's one of those things that it's hard to get other family members to understand what people are going through. So, in that sense, when should someone seek treatment?
Certainly, there's really two powerful forces that help somebody seek treatment. The first is the individual themselves, and if they're feeling powerless or unmanageable or patterns that are destructive, they need to find out if the disease is there. The second is the family, and the thing the family can do to support care is look at, are there legal issues, are there employment issues, are there health concerns, and those are opportunities to take a different path.
When you start looking at all those things combined, certainly. I would imagine it would be emotional or almost challenging process for both the patient and the family. I know that I've seen it myself in my own little sister and how everyone has gone around her. But you do handle those challenges, right?
Of course, and really the first thing that we're going to share with everybody, whether it's an individual inquiring about themselves or a family member about a loved one, is we're talking about sick people with an opportunity to get well, not bad people trying to get good. And so that's the first part, is this is somebody that you love and you can continue to love them. And then we show family members what they can do to support and put the structure on the place that might help somebody seek treatment and then support their recovery. And for an individual, help them learn about the disease and the consequences and some of the feelings that they're having, and as a result of that, and that there's an opportunity to live a different way.
Can you say that one more time? Sick people trying to get well.
Not bad people trying to get good.
Can I high-five you on that one?
Sure.
I love that.
Sure.
All right, well, what makes Lakeside-Milam such a comprehensive or complete treatment center?
Well, there's two aspects of that, and first is the continuum of care of the outpatient centers and helping people that aren't as sick, but then there's the residential center, and we've got a 6-acre campus in Kirkland, so individuals can come if they're in need of medical care. We've got withdrawal management with physicians and nurses, as well as residential care that follows that, so you're going to have the support of the counseling staff and the education that goes along with that. And so you've got somewhere that the community can come, so family members can come participate in a family program in that residential center, and then folks go back to the outpatient care, and so in their home then the support is there for them in early recovery, and that can continue to help them process some of the things they've learned.
Okay, that is so key, is that follow-up as well. Finances, I know, can be a big barrier to treatments. Sometimes insurance helps out, sometimes it doesn't. Are there financial services or is there help that you can provide? Sure.
So Lakeside-Milam Recovery Centers was started with helping the, if you will, the middle class. My father started Lakeside-Milam Recovery Centers in 1983, and part of that catalyst was he had a daughter that needed care, and there was public programs and there was high-end treatment, and he couldn't get care for her. And so what we've done is we've made sure to stay in network with all the major providers.
Nice.
And there are federal laws and state laws that require insurance companies to cover chemical dependency or addiction treatment. So if somebody in the Puget Sound area in need of care, we can help them.
That's such a great resource. What is the first step?
The first opportunity for somebody that is wondering if there is a problem for the individual is to reach out and from a professional, and we offer this at Lakeside-Milam Recovery Centers, of course, is an assessment to come into an outpatient treatment center. It's 100% confidential, there's no charge, and to talk to that counselor, and there's some written questionnaires, but mostly it's a back and forth discussion to identify if the disease is there. If the disease isn't, then there's an educational program available, and if the disease is there, what level of care, what type of treatment is appropriate can be shared at that point.
And that's free just to get that assessment?
That's free and 100% confidential. So every individual should do that if they're wondering about themselves. Every family member concerned with a loved one should ask them if they're willing to do that. And if they're not, ask them when they are.
Yeah, no pressure. And you know what? And don't be ashamed or embarrassed. This is so great that you offer this in such a thoughtful way and a private way. And I'm so grateful that we talked to you this morning. Thank you so much.
My pleasure. Thank you for the opportunity.
Absolutely. And of course, to reach out to Lakeside-Milam Recovery Centers, even just to find out what they do offer, you can visit the website lakeside-milam.com. All right, when we come back, we are positively, perfectly happy to talk about a birthday celebration. We're going kitten crazy after this.
This portion of New Day Northwest is